You're watching Reality Check. Our focus tonight is on India's mega cities because the worry is that it's the big cities, Mumbai, Delhi, Ahmedabad, that are pushing the COVID surge in India, but they are not testing enough. In fact, there are worries that these cities might actually be trying to create obstacles in the way of testing. Joining me tonight is the man with perhaps the toughest job in India, the Mumbai Municipal Commissioner, I.S. Chahal, is here on the show. Thank you very much indeed, sir, for being with us on Reality Check. And we will be just coming to you in just a second. But before that, let me just go through the numbers to look at what the big concern is when it comes to India's mega cities and when it comes to testing. So overall, India is not testing great. India is at the bottom when it comes to tests per million. It is only testing about 3,000 per million compared to countries like Russia, Italy, USA and so on, which are testing anywhere between 47 to 82,000 per million. My colleague Mariam Alavi also joins me. She joins me to look at some of these questions when it comes to testing. And the question really is, Mariam, that when you look at the individual states, you look at these hotspot states, that it's really a challenge because these are states which are showing a high number of deaths per million, but their tests are not that high.
Exactly. Even for a state like Delhi, which is testing at about 12,475, they're doing about close to 13,000 tests per million population. But their deaths per million are quite high as well, 48.5 deaths per million population. It's even more worrying if you look at states like Maharashtra and Gujarat, which are testing quite low, between 4,000 and 5,000 tests per million. But their deaths per million, their death rate is much higher.
Right. That's the worry. And let's put those graphics up on the screen so our viewers can understand what exactly it is we're talking about. That you have the situation where you have states like Maharashtra and Gujarat. These are states that are seeing a high number of deaths. But when it comes to tests per million, they are actually testing low. So if you look at the graphics, you look at both of them side by side, you'll see that it's almost like an inverted x-axis. Low when it comes to actually the number of tests per million, but high when it comes to deaths per million. And the worry though, Mariam, is that if you actually look at these cities, if you look at Delhi, you look at Mumbai, you look at Ahmedabad, your analysis finds that the rate of infections, the pace of infections is outpacing the rate of deaths.
Yes, so definitely these states and cities have picked up their testing to a certain extent, but they're not keeping in pace with the rate of rise in infections in those cities. Delhi, for example, has increased their daily tests by 50%. This is when you compare the week of May 3rd to 9th with just the week that passed by June 1st to 7th. So their daily tests, their average daily tests have increased by 50%, but their daily cases have increased by almost 300%. That's about triple what it was earlier. In Mumbai, similarly, daily tests have almost been stagnant. It's increased only by 2%, whereas the daily cases have almost doubled at 110%. In Ahmedabad, again, their daily cases are also stagnant, but their daily tests are also not rising much. Their daily tests have risen only by about 3%.
Okay, so that's the big challenge before us. We have a full panel tonight, but let me just start with Chahal Saab, who's been listening patiently. Chahal Saab, thank you very much indeed for being with us. Now, I know that literally as of the past few days, you have relaxed testing protocols in Mumbai, and the before and after is quite dramatically different. Now, Chahal Saab, earlier you needed a sign-off from a doctor. You needed a sign-off from a government doctor before you could go and get tested. House tests were not allowed. Now you've actually said that for contacts of high-risk cases, you can actually self-attest and go and get tested. And this applies to doctors and hospitals as well. That's a huge change, and that is likely to make testing much more easier for Mumbaikars. But the question, Chahal Saab, is why did it take so long? Why wait so long before opening up testing protocols? Why was Mumbai making it so hard for people to get tested?
Good evening, Srinivasan. First of all, thank you very much for giving me this opportunity today evening to present our case. Mumbai has tested highest in the country. We have done 2.3 lakh tests now, which is number 1 in the country. And we have done 17,600 cases per million, much higher than Delhi, 12,000, much higher than Gujarat, 3,000, much higher than Bangalore, 4,000. Ours is 17,600 per million for MCGM, right. BMC. And now, you know what happened on 13th of May, right. ICMR issued new guidelines of testing. And they prescribed that only symptomatic cases can be recommended for test. And the flu clinics, 404 flu clinics and 1,500 RMPs of Mumbai, they were instructed by ICMR that only symptomatic cases should be given prescription. And the second and the last category of people who could be tested were high-risk contacts of positive cases in our government quarantines. Now, we have been always diligently obeying ICMR guidelines in letter and spirit. We have never violated or breached their guidelines. This was exactly their guidelines. So what has happened that when people started going to new clinics,
you may not have violated.
They were not given the prescription unless
you may not have violated the ICMR guidelines, but you did make it harder by introducing categories like saying that people needed to get a sign-off from a medical, not just a doctor, but also from a government-appointed nodal doctor. He had to sign off, or he or she had to sign off. Number 2, what has happened, Chahal Saab, is that the BMC has gone after a number of private clinics, private testing centers. No, just a second, let me finish. You've gone after, let me just finish. You've also gone after, let me just finish one point. Chahal Saab, just one point. You have also gone after a number of private testing labs in Mumbai. Virtually every private testing lab has had show cause notices issued or cases filed against it. This has made them extremely wary of testing.
No, this is not true. Let me correct you that when I joined, I found that 4th of April swabs reports had come on 22nd April. Now the labs were committing a very serious crime by delaying the reports for 18 days. So they deserve to be punished because we couldn't wait for tracking the high-risk contacts. And I told them that unless you give me the swab reports in 24 hours, you cannot function in Mumbai because I can't accept your reports after 15 days, 16 days. You don't chew more than you can digest. So what has happened that after this government of India guidelines came, I could get only about 3,600 cases of symptomatic every day from slums of Mumbai and other places. Now I couldn't manufacture symptomatic cases in Mumbai, which was the guidelines of ICMR. That is why the testing fell down. And now what we have done is we have gone beyond ICMR guideline. We say that we have thousands of hospitals in Mumbai, more than 2,500. Every hospital has been authorized to go ahead with testing. We have said that for high-risk contacts of positive cases who are home quarantined, their swabs can be collected at home, whereas ICMR said that no home collection of swabs. We have gone and gone beyond that now, but the issue was that when the strict guidelines came that only test only symptomatic cases only in the flu clinics. So what we do? And when I was asking my officers every time that why it is decreasing. My answer I was getting was more than 3,500 symptomatic cases are not available in Mumbai. So it was silver lining that our cases were coming down.
Okay, understand. But tell me though, Tell me this. Overall, though, where is the position of Mumbai when it comes to actually handling the virus? Because the fear is that even though you say you're testing the highest in terms of tests per million of any city or any part of India, it's not revealing the full picture, and Mumbai is increasingly getting overwhelmed. Could you give us, in terms of numbers, how many hospital beds do you have, general or ICU for COVID?
Yeah.
And what percentage are full?
Please give me
right now. What percentage are full?
Just 3 to 4 minutes.
How many hospital beds, sir?
You know,
and
today,
what percentage is full?
Latest figures of Mumbai are 49,000 positive cases. Out of 49,000 positive cases, 22,000 people have been discharged after treatment. The active cases are only 25,000. Out of 25,000, 18,000 people are home quarantined, or they are in CCC where there's a BMS doctor only. Actually, number of people occupying my hospital beds only 7,000.
Yeah, but if you give me the figure for the hospital beds.
500 beds ready today,
sir, but
which means...
Yes.
Oh, yeah, I'm talking of DCHC and DCH only.
Yes.
DCH and DCHC only, I have 10,420 beds, and today about 7,200 are occupied. Now I come to the best example of Dharavi.
Okay.
Dharavi, when I joined, Dharavi was giving us 100.
No, if I can just come to ICU, how many, sir? Before you come to Dharavi, sir, before you come to Dharavi, you've given me about the general beds.
Yesterday I had 10 cases. Today I have 9 cases. Day before I had 11 cases.
Okay, but how many ICU beds,
in a slum of 8 lakh population, just 9 cases.
How many ICU beds do you have? Okay, how many ICU beds do you have, and how many are full? ICU and ventilator. How many beds and how many are full?
Today I have 1141 ICU beds, and still I have 30 beds vacant today at this point of time.
Just 30 beds, sir. Isn't that a very small number?
Because you know, when I joined, we had only 371 ICU beds, and it had risen to 1161 in the just about last 4 weeks, and it will rise by another 500 in the next 10 days.
Okay. Okay, we hope so. Let me also go to Saurabh Bharadwaj, because in some ways, leader of the Aam Aadmi Party who's joining us also from Delhi, because in some ways the same story, Saurabh, is being replicated in Delhi, where a number of instances have surfaced of the Delhi government attempting to, it would appear, almost stifle testing, where you've actually broken from ICMR protocols, and you've said that it will only be people who have some kind of heart condition, cancer, diabetes, who you will allow to be tested. The Lieutenant Governor has overruled that, in addition to overruling your attempt to only make Delhi hospitals for Delhiites. And that, Saurabh, has led to a lot of people complaining that it's becoming harder and harder to test. And there are a flood of complaints on social media, people coming and posting videos. We actually have a package that we're going to line up and play for you. If you can play that package, which will give you an idea of the kind of complaints that people have in Delhi when they're not able to test. Let's listen.
नमस्कार, मेरा नाम वरुण है और मैं रोहिणी दिल्ली का निवासी हूँ। एक्चुअली कुछ दिन पहले मेरे कज़न को कोरोना पॉजिटिव डिटेक्ट हुआ था और मैं उसके साथ कांटेक्ट में था, तो मुझे भी सिम्टम्स आने स्टार्ट हुए, फीवर, कफ वगैरह। तो मैंने सोचा मैं खुद का टेस्ट कराऊँ। देन मैंने गवर्नमेंट के हेल्पलाइन पे कॉल किया, दिल्ली गवर्नमेंट की पे। उन्होंने मुझे कहा कि अम्बेडकर हॉस्पिटल जाओ, डॉक्टर बाबा साहेब अम्बेडकर। मैं 2 जून को वहाँ पे गया, तो उन्होंने, डॉक्टर ने मुझे कहा कि 2-3 दिन टेस्ट बंद है, आप 4 जून की डेट ले लीजिए। 4 जून को मैं गया, यानी कल, तो वहाँ पर देखा तो हॉस्पिटल में भीड़ थी और सैंपल कलेक्ट नहीं हो रहे थे। मैंने काउंटर पे पूछा सैंपल कलेक्शन पे, तो उन्होंने कहा कि ऊपर से परमिशन नहीं आई है।
मेरे घर में जैसे मेरे 15 सदस्यों का परिवार है मेरा, जिसमें 2 सीनियर सिटीजन है, 4 बच्चे भी हैं छोटे छोटे। उनकी तबीयत थोड़ी सी ढीली भी हो रही है। मैं किसी हॉस्पिटल के अंदर गया, मेरे को वहाँ पर ये बोला कि हमारे सिर्फ 50 किट आती है। मैं 11 बजे वहाँ पहुंचा हूँ, तो उन्होंने मेरे को मना कर दिया, सर आप सुबह 9 बजे आइए। 9 बजे पहुंचता हूँ तो भी मेरा रिस्पॉन्स नहीं मिलता, कि सुबह 7 बजे आइए। अब सीनियर सिटीजन जो है मेरे, उनकी इस समय पेशेंट की तबीयत खराब हो रही है। अब मैं इस समय नाइट के अंदर किस समय कहाँ जाऊँ मैं? कोई एम्बुलेंस नहीं आई पेशेंट को देखने के लिए, कुछ नहीं हो रहा। पुलिस स्टेशन में भी डायल किया है, वहाँ से मुझे जवाब मिला पुलिस स्टेशन से कि सर आपको हम कुछ हेल्प कर रहे हैं, अभी आपके पास प्रोवाइड कर रहे हैं।
नाम सत्येंद्र कुमार झा है। हमारे पिताजी को 6 तारीख को कोरोना पॉजिटिव निकला। हम लोग तब से हेल्पलाइन नंबर को फ़ोन कर के थक गया हूं कि हमारे पिताजी के कांटेक्ट में हमारे परिवार के जितने भी सदस्य आए हैं उनकी कोरोना की जांच हो जाए। हमें हेल्पलाइन नंबर से इस हॉस्पिटल से उस हॉस्पिटल भेजा जा रहा है, डिस्पेंसरी भेजा जा रहा है, कभी प्राइवेट लैब भी हम जा रहे हैं, वहाँ भी मना हो रहा है। हमें कहीं से कोई जांच की व्यवस्था नहीं देखी जा रही है।
Okay, so Saurabh, why is it so hard for people in Delhi to get tested? You've also gone after testing, private testing labs, put cases against them. The allegation is that this is an attempt to suppress the numbers.
I'm glad that you are having a discussion on testing, and I think not many channels are doing this discussion. So, and I think it is important that we are discussing the real issues which are related to corona. As far as testing is concerned, I think, and I frankly believe that more patients is directly linked to more testing, and somehow in this country more patients is something which makes headlines. And I think you can see it as an effort in most of the states that testing is being suppressed. Like Delhi, we are doing around 12,500 tests per million. Tamil Nadu, it's around 7,000. Rajasthan, it's around 6,000. Gujarat is 3,500 tests per million. And UP, for that example, is 1,500 tests per million. And this is directly related to the number of positives. The more you test, the more positives you get. And there's a lot of suppression which is happening at different levels, at different states.
No, Saurabh, the fact is, just a second.
Yes.
The fact is, Saurabh, let me just jump in there. Saurabh, the fact is that when it comes to tests per million, it is true that Delhi is testing quite high, just like Mumbai tests per million is high. But the growth of the tests, the average growth of the tests, as we pointed out, is just 50%. The daily cases are rising by almost 300%. You should be testing much, much more. Instead, as we just heard, the frustration of people who are trying to get tested. So again, I come back to you. Is the Delhi government trying to dabao the numbers to try to make the numbers look better?
No, I think many patients who couldn't get tested in last 2-3 days. I think this problem of not getting tested is something which has happened in last 2-3 days. And it is because of a situation where it was said that asymptomatic patients will not be tested, and people who believe that they are afraid that they may be positive but they don't have symptoms. So that is a kind of a confusion. And we were also in the process. We were also getting similar complaints.
So you're saying that that's creating a confusion.
Discussing it with the government that somehow we can review it. Because there are a lot of people who feel that they may be positive, but they are not sure.
Okay, I hope that you will review it, because you need to relax the guidelines much more. Dr. Sanjay Nagral joining us, a senior doctor from Mumbai. Dr. Nagral, this is a problem, is it not, that these mega cities are not making testing easier? Now Mumbai has started to relax its guidelines, but up till now it's been pretty tough.
Yeah, as you pointed out, there was a phase when testing was really made very tough, very restrictive. I really don't know the reason for that. But as somebody who's observing the epidemic unfold in Mumbai almost every day, now I feel, and I venture to say this, that perhaps what we need to do is to move the discourse from testing is important, and contact tracing, quarantining is of course important, but I think the discourse also needs to move around mitigation.
Yes.
Because we can keep on debating, but I think this is community transmission now, full scale, and I think mitigation measures is also where the cities are failing, and there's again a lot of good intention, hard work. MCGM has put in a lot of hard work. There's a dashboard now, there's a war room, but we still see very poor coordination, patients moving from hospital to hospital. and the ICU beds, and it is projected by people on the ground.
Right.
I've talked to intensivist colleagues that in the next few weeks, we are going to need many more ICU beds, at least oxygenated beds. So I think we need to probably now move the discourse in the...
Yes, I think that's very important. Okay, you're saying that we need to now move towards how to actually handle this rising tide. And let me just go back to Chahal Saab for that. Chahal Saab, you mentioned that you have about 30 ICU beds free. You said that's a big improvement from when you took over, but 30 still seems like a small number. What sort of projected number for Mumbai are you looking at, Chahal Saab, in the weeks and months ahead? You're already at about 45,000 infections. Where is that number going to go in, let's say, a month or 2 months?
Srinivasan, you know, we have right now 1161 ICU beds, and we are adding another 500 in the next 10 days. And our doubling rate is now 23. And experts tell me that once I reach a doubling rate of 30, the beds will freeze. That whatever beds we have, they should be sufficient. Once we touch doubling rate of 30, and we are already at 23 today. Places like Dharavi at 42 doubling rate.
That is, your cases are doubling every 23 to 30 days.
Cases, we got nine cases in one day today. Our Honorable CM, he directed me to to start this chase the virus policy. We said instead of virus chasing it, we are going to chase the virus. And that is highly successful in the last 3 weeks. What we have done is that once we get a positive case from a slum, we pick up 15 to 20 high-risk contacts and put them in government quarantine and sanitize their homes. And we take care of them for 10 days. If they develop symptoms, we treat them. If they don't develop symptoms, we discharge them. I have now almost 40,000 people coming to government quarantines every week. And this is the reason why Dharavi's positive has fell down from 180 cases a day to just 9 cases today.
But Chahal Saab, if I may ask you this, that you're saying, okay, Chahal Saab, you're asking me, let me ask you this, you're saying that you are comfortable with your hospital beds and all of that, but at the same time, you've just issued an order where you've got now IAS officers assigned to each of Mumbai's private hospitals to make sure that there are enough beds. Doesn't that suggest that you are worried about getting overwhelmed?
No, Srinivasan, the reason is different for that. There were a lot of complaints that the private hospitals are overcharging. We had decided that they'll be charging 4,000 rupees for a bed, 7,000 per oxygen bed, and 9,000 rupees for an ICU bed. When the complaints came that the overcharging, we have put principal auditors in these hospitals, 2 in each hospital, and now basically we'll be monitoring their billing. Their beds are already on the dashboard of ours. We are lotting their beds. Problem was billing and displaying the incidental charges like charge of PPE kit or a mask or medicine. It should be well displayed. So basically these IS officers
understood. So you're trying to
regulate
sort of
the pricing.
Malpractice. Okay, understood. I understood. Look, any attempt to curb malpractice by private actors, overcharging and whatnot is good, but as long as it doesn't become, quote unquote, a war between the state and private healthcare, because that's the last thing that Mumbai or any city needs. But anyway, thank you so much for taking time and joining us tonight, Mr. Chahal. We wish you all the very best. You have a huge, challenging task, and we really hope that you're able to win this war, as we do with Saurabh Bharadwaj and in Delhi and everywhere else. Thank you all so much for joining us on Reality Check. That's all the time we have. Thanks for watching. Good night.